Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Hi, I'm Caitlin Tivnan. Thank you for watching Health Watch, presented by UMass Memorial Healthcare. We're here at the Blood Donor Center to talk a little bit about why it's so important to donate blood and exactly what it's used for here at the hospital. So can you tell me what happens here at the hospital as far as blood donation? You must go through a lot of blood.
We do, absolutely. UMass transfuses about 1,500 to 2,000 units of blood per month. Every month. About 25% of it is collected here at our own blood donor center, and it's used for a variety of patients. We have a very active cancer center with bone marrow transplants, trauma center, as well as solid organ transplants such as liver and kidney.
So who usually comes to donate the blood?
We have a percentage come from the medical school and the employees. We also do have people from the community who come. We do provide free parking, so we would entice others from the community to come and donate for us as well.
How important is it that you have blood, and is it stored right here? I mean, how much do you rely on it?
We do have a blood bank where the blood is stored. Red cells are refrigerated, so they're good for 42 days. So after someone donates, they do expire after 42 days. Of course, we do not expire a lot of blood products here at UMass because we only collect about 25%. Also, platelets are only good for 5 days, and so they're essential in the treatment of cancer and in traumas as well. So we try to keep our platelet donations up as well.
So it's important that you have a consistent stream of people coming in to donate then.
That's correct. There's only about 5% of people who are eligible to donate who do actually donate, and so they supply the blood for the rest of the population in Massachusetts and the United States.
And just being a hospital, do you think sometimes people don't think that it's such a place where blood is needed so often, whereas you hear a lot about blood drives during disasters and other things, but this is a hospital where blood is used on a day-to-day basis.
Right. People do not always think of hospital-based blood donor centers. They generally do think of centers such as the Red Cross out in the community, but it's essential that people remember that the blood that's donated here at UMass stays within the UMass system. And people have told me that some of the reasons they don't donate is that they've never been asked. So I would like to invite you to donate and just invite everyone it's possible for them to donate who are healthy to please come and donate blood.
And I guess I should ask you, what's the process like? Is it complicated? Is it long? Do people need to know it's pretty simple?
It's very simple. If you're healthy, free of infection, even just colds, you cannot donate. But it takes to donate a unit of whole blood, which helps actually 2 people, it takes about a total of 45 minutes and often less than that. We also have a process here where we have people donate single donor platelets. We use a machine for that, and it's one arm, there's a needle in one arm, and we're able to get 1 or 2 blood products from that as well, which is also essential. And most first-time donors do express that they were shocked to see how simple that it was to donate.
And do you ever see yourself facing lulls or lows when it comes to the blood supply? I mean, do you find yourself needing donors more often than not at certain points in time?
Absolutely. Well, for example, just the hurricane last week. Hurricane Sandy affected blood donations all up and down the East Coast, so kind of a downward effect to us as well. We didn't really collect a lot of blood products the day of the storm, but then subsequent, it took us a while before we brought our levels back up to what we like to keep here in the blood bank. And then during the holidays, people are busy with their schedules and often don't think, and I think that's the basic problem. People just don't think about donating, and until maybe it affects their own personal life or their friends.
So 1 unit of blood, what could that 1 unit of blood that you donate go to do, or what could that do for someone here in the hospital?
If you donate a unit of whole blood, it'll be separated into red blood cells and plasma. So you'd be helping 2 different people. And it could be a child undergoing cancer therapy. It could be someone who's just undergone a bone marrow transplant. It could be a trauma that has come in from a motor vehicle accident, and with the helicopter, we are a very busy trauma center here. So it could be a variety of patients. People undergoing like a liver transplant or a kidney transplant may require blood products. And it could be someone that it's most likely someone you don't know. It could be someone that you do know, but people need to know that when they donate blood, they're helping someone. They're actually saving someone's life, and they need to know that.
And then how much blood do you have here in the donor center, in the donor blood bank?
Well, the types that we obviously we are most concerned about, we're concerned about all types, but O type is the most common blood type, O positive. We keep around 100 units here at UMass. University campus and probably another 50 down at the Memorial campus. It's considered one hospital. So an O negative, which is the universal donor, which is essential in a situation like us where we have the trauma center, we probably keep between 40 and 50 of those units on hand here and between 20 and 30 down at Memorial. That's what we like to, but we do dip lower than that, unfortunately, but we try to keep it at that level.
Who can donate and how often? And
okay, 17 years of age is the youngest that you can donate, and there's actually no upper age limit anymore. There used to be years ago, but we find that our aging population are generally pretty darn healthy. And you can donate every 56 days. That gives your body the opportunity to build the blood back up. If you donate platelets, you can actually donate that every 2 weeks. We also, there's a variety of things, reasons why you can't donate if you've traveled to a malarial country, things like that. We'd be happy to answer any questions if people would like to call, and we can screen the questions over the phone to save them a trip if they're ineligible. But most everybody that is healthy can donate blood, even if you're treated for something like high blood pressure, as long as you take your medicines, things like that. So,
now I guess when someone donates, maybe it is a little off-putting when you just see the amount of blood. It looks like a lot when it comes out and it fills up the bag.
That's correct.
What's happening in your body, though? I mean, obviously that's a safe amount of blood to be taking out of someone, so you're pretty much fine after you give that away. Does your body just replace it right away?
Yeah, you usually replace the fluid amount within 24 hours, and that's why we encourage that people have drinks before they leave, and we usually give them 1 to 2 drinks, and that's about what you've just given us. We collect about 450 milliliters, which if we tell people think of a half of a liter bottle of soda, that's what they're giving us. So we try to get them at least that much back before they leave us. We don't let anybody walk out the door until they're feeling well, but the majority of people feel fine. They're able to drive afterwards. There's not any limitations. Some people who are very athletic prefer to do platelets over red cell donation because they don't lose that red cells, because it does take about 4 weeks to build your red cells back up again. But that's why the donation period is 8 weeks, to make sure that you're healthy enough to donate again in 8 weeks.